Documentation, the most frustrating part of your practice. You've seen the requirements change, demanding more and more of your valuable time. In fact, doctors, it's estimated that over 60% of your practice time is dedicated just to paperwork. You want a solution? I'm Ron Savaggio with DocPlus. For over 15 years, our company has been dedicated to developing the most complete and effective documentation and record-keeping system available in the marketplace. You see, DocPlus was created by doctors for doctors. Thousands of doctors throughout the country have become more efficient, better organized, and enjoy more free time thanks to this remarkable system.
DocPlus has probably freed up 10 hours a week. Over my 20 years in physical therapy and chiropractic, I've probably worked in 20 clinics. And without a doubt, I gained 10 hours a week, 40 hours a month, because the system is so efficient.
We've been on DocPlus for about 8 years now, and I don't know how in the world I would practice without it. It just puts in more or less a framework or a template for you to practice. And it makes everything gel together, and everybody in the office knows exactly where the data is.
We have more of a ready room than we do a waiting room. Because our forms are so much faster, it allows the patient to spend more time with the doctor discussing other health concerns that they may have.
Now let's meet Dr. Chris Kaloka, one of the doctors who is experiencing the benefits of DocPlus. Listen carefully as he explains in detail how the system works and how it can help you too. Doctors, now is the time to end that terrible paperwork nightmare. Dr. Chris Kaloka.
It's been said that if it isn't written down, it didn't happen. And when discussing medical record keeping, this couldn't be any more apropos. After all, you're only as good as your records reflect. I'm Dr. Chris Kaloka, and in the next few minutes, I'm going to give you a brief overview and demonstration of the DocPlus record keeping system. By giving you an overview of the system, you'll be introduced to DocPlus and be able to see how it works in a very short period of time. For those of you interested in more details of the system and the solutions that DocPlus has created for today's documentation and medical record-keeping requirements, we'll have a more detailed discussion in the next segment of the program. First, though, let me show you how DocPlus works. DocPlus brilliantly organized a massive software database program to interface with scannable forms that patients, doctors, and staff can all enter information on. In this way, when the patient or the doctor entered information on a form, the data is then captured by the computer and stored in electronic file format, which can then be used to produce the report that is desired, whether it be an initial visit report, a SOAP note, or a full narrative report. The best part of the system is how easy it is to implement. The DocPlus system can convert existing paper files into electronic medical records. Patients continue to fill out forms as they always have, and we're able to organize the patient's health information meticulously and produce impressive documentation to third parties. DocPlus consists of a software program, a scanner, and special optical mark forms. The hallmark of the DocPlus system are the scannable forms. These forms have been specifically designed to keep handwritten information to a minimum and to eliminate using precious staff time to enter key patient information. Any forms that are completed during the patient encounter are scanned and stored into the patient's database. DocPlus solved the paperwork nightmare using this type of electronic storage. In one screen, you can see all of the forms related to the patient's case, and then generate the documents that you need. This way, records are generated to accompany billing or to fulfill a request for medical records. At that time, with the click of a button, full narrative reports and SOAP notes can be produced. Let me walk you through the forms and the system so you can see how DocPlus works.
Good afternoon, Dr. Peterson's office.
When new patients call for an appointment, demographic information is collected by the staff on the confidential patient information sheet.
Hi, I'm Bill Kane.
Hi, Bill. Welcome to our clinic.
New patients are first given the health history questionnaire, which collects all of the necessary information about the patient's condition and their medical history. Once this form is scanned, the software provides prompts for the staff to enter in any handwritten information by the patient. The thoroughness of the health history questionnaire makes that first impression with patients special and instills confidence in the doctor's ability to manage their case. A patient history summary can be quickly produced for the doctor to review prior to seeing the patient in the initial consultation. We use this patient history summary report to enter in any other information that we obtain from the patient during the consult, so it can be included in their notes as well. Medical records from other providers can be scanned into the patient's electronic medical record. Patients who are involved in an auto accident are given the DocPlus Auto Accident and Accident Injury questionnaires. The Auto Accident questionnaire obtains all of the necessary information about the accident and the mechanisms of injury, while the Accident Injury questionnaire captures data about the patient's injuries resulting from the accident. The Accident Injury questionnaire is also administered to patients who are injured at work, so we can properly document our workers' compensation cases. On the initial visit, outcome assessments should also be administered, and then again given to the patient at each re-examination visit. Imagine incorporating reliable and valid instruments from published scientific literature to assess just how your patient's condition is affecting their quality of life. Using outcome measures also allows you to chart the patient's progress quantitatively by the numbers. You're probably already familiar with these instruments, with their recent rise in popularity and requirements from third-party payers. The DocPlus system includes the Health Status Questionnaire, or SF-36, which is used to get a picture of the patient's perception of their overall health. The Neck Disability Index is used for patients with neck pain, headaches, or upper back pain. The Rowland-Morris Disability Questionnaire provides 24 questions pertinent to acute low back pain patients. And the Oswestry Low Back Disability Questionnaire is administered to chronic low back pain patients. When each of these forms is completed and scanned, a report is generated that presents the patient's overall disability score and the category of disability that they're suffering. Using outcome measures helps you demonstrate to patients just how their condition is affecting the things they do every day. Patients will also better recognize the benefits that they've achieved through chiropractic care. Motivated patients have better retention and refer. When you can document the patient's progress, third-party payers can understand the need for continuing care and improves your collections. These are just some of the benefits of quality records. DocPlus has two forms that the doctor can choose from to collect data from the physical examination. The blue clinical evaluation form is the more comprehensive of the two, and it accommodates just about every physical exam test that you can think of. These forms even accommodate any special tests that may be unique to your practice. Any tests that are not performed are simply left blank and are thus not included in the notes. Using this form allows you to effectively move through a physical exam and quickly record your findings, which are captured by the system and indexed in the patient's database. The level of service recorded with these forms will impress even the most discerning insurance carrier or claims adjuster. If x-rays are taken, a radiographic report allows you to document the x-ray findings as well. After these forms are scanned, various reports can be generated by the staff. An initial report can be generated for the insurance company to accompany billing. A report can also be generated for attorneys in the format that they desire, or sent to a referring physician. Many doctors using the DocPlus system send initial visit reports and progress notes to the patient's primary care physician. These typewritten reports communicate your level of service and professionalism and speak volumes to the quality of care that you provide, serving to increase external referrals from physicians. Based on the patient's information, the DocPlus system even allows you to generate a written report of findings that can be given to your new patients. You know as well as I do how difficult it is for a patient to understand what's wrong with them, so giving them a written report allows us to communicate their condition and your findings in layman's terms so they can understand. We found that patients are very appreciative of how thorough our office is with their health, and patients are quick to share these reports with their family and friends. This boosts patient retention and stimulates referrals. The DocPlus system even allows your staff to quickly generate customized welcome to the practice and thank you for your referral letters. You probably didn't know that a documentation system could do all of this for your practice to help it grow. On established patient visits, the daily note form is used to document the patient encounter. In about 30 seconds, or even less sometimes, we are able to record the details about the patient's symptoms, their intensity, quality, frequency, and their progress since the last visit. The daily note form also has a section to collect a visual analog score on each visit and a pain diagram, which the patients complete. Objective findings and levels treated are documented by the doctor on the back side of the form. Doctors can quickly report their assessment of the patient and any alterations to the treatment plan to complete the SOAP note. A new form has even been created for chiropractic biophysics practitioners to accommodate the detailed postural analysis of the technique. The daily note form also serves as a travel card. After the patient's initial visit, daily note forms are put into the printer, and the DocPlus system will print the patient information that you need right on the form. This way, only one sheet of paper travels with the patient through the office. And on this daily note form, you have the patient's diagnosis, their subjective complaints, X-ray findings, visit schedule, objective findings, and the specific levels that you treated on the last visit. Also printed on the form are the therapies that the patient is receiving and their progress with care, so you can better manage patients. Another incredible feature of the daily note form is its interface with many of the practice management software programs. The form can act as a fee slip, where once it's scanned, the procedures performed are imported and posted to the patient's account with the appropriate charges assigned to that particular case. This feature also provides a system of checks and balances where your documentation always matches your billing. When records are requested, simply select the dates of service that you need records for and generate the notes. Each daily note form will produce typewritten SOAP notes that are both thorough and professional. Documenting patients' progress is vital to a chiropractic care plan. Re-exams are recorded with either the clinical evaluation or the clinical reevaluation form, depending on the level of service provided. Reevaluation reports are generated, which pull data from the patient's initial visit for comparison with the current findings. This way, we can effectively communicate the patient's progress and response to care in a reexamination progress report. The DocPlus system is easy to use and versatile. The system software even allows you to customize it to accommodate special tests or procedures that may be unique to your office. For example, you can create your very own database of exercises that you frequently prescribe to patients so that you can include this information in your daily notes.
I've had comments from attorneys that they're the nicest records they've seen, and that means a lot when you're trying to build up a reputation with an attorney in hopes that you'll get referrals from them as well.
All the clinical data is right there just for my daily notes, and of course the exams, re-exams, and it's all compiled in a very organized way, and you literally just press a button and there it is. And if you do need to make any changes, it's very simple.
I love using DocPlus. It has made life so much easier in the office. Things are so much more efficient. They run better, things run smoother, quicker. I see more patients, work gets done faster, reports get done on time.
I've had, in the 30 years of practice, many documentation systems. None of them have even held a candle to what DocPlus does.
The greatest challenge for doctors not being paid in this new era that we're in is that doctors fail to understand the importance of documentation in the entire reimbursement process. Those who fail to document then become guilty, unknowingly, of fraud and abuse allegations because it appears that the work was not even done as far as the records are concerned. Therefore, the new era of fraud and abuse is all focused upon doctors who've not documented and documented well. That's the value of a system like DocPlus. The records are there.
It's more or less like having malpractice insurance. It is the most important thing second to your malpractice insurance.
By now, you've received materials including samples of the DocPlus forms and various reports that the system produces. Take time to review this information to get a better idea of the quality of record keeping that this system entails. Quality records, organization, efficiency, increased referrals, retention, and collections are all benefits that I and hundreds of other doctors have personally experienced with the DocPlus system. There is no doubt in my mind that DocPlus is the most comprehensive and efficient record-keeping system on the market. I hope that you too can experience practice growth with confidence and conviction in your records, have less frustration, and enjoy free time to do the things that you enjoy by implementing the DocPlus system.
Documents Plus works really well, and I would encourage any doctor to implement the system in their practice.
Documents Plus will pay for itself in the first month if you utilize the features.
If an individual is considering implementing Document Plus, I would say absolutely. No reservations, and just call someone who's been using it. It's the best system that I've used.
Feel free to call Document Plus toll-free to speak with a customer service representative anytime to learn more about Document Plus and how it can help you in your practice.